The men who were never treated. The Tuskegee Syphilis Experiment, true story. Subscribe to the channel. In 1932, the U.S. government promised help to 600 poor black men in Macon County, Alabama. They were told they would receive free medical care for bad blood, a vague term covering many illnesses. What they were not told was the truth. 399 of those men had syphilis. The rest were healthy. None of them were informed of their diagnosis. None were asked for consent. Instead, they were enrolled in a government experiment designed to observe how syphilis destroys the human body when left untreated. Doctors watched. They took blood. They performed painful spinal taps. They recorded symptoms as the disease ate away at minds, nerves, and organs. When penicillin became a proven cure in the 1940s, the researchers made a decision. They chose not to treat them. Subscribe to the channel. The men were actively prevented from getting help elsewhere. Local doctors were instructed not to treat them. Even when some were drafted for World War II and diagnosed by the Army, the government intervened to keep them untreated. Over the years, men went blind. Men went insane. Men died slow. Documented deaths. Wives were infected. Children were born with congenital syphilis. Families were destroyed, not by ignorance, but by design. The experiment continued for 40 years. It ended only in 1972, when a whistleblower leaked the truth to the press. Public outrage followed. The study was finally shut down. By then, dozens were dead, many more permanently damaged. No researcher went to prison. In 1997, 65 years after it began, the U.S. government issued a formal apology. Most of the victims were already buried. Medical textbooks still reference the data collected from their suffering. They were never patients. They were specimens. If you like this story, subscribe for more stories like this. Thanks for watching.